Let's talk about one of the biggest shakeups modern medicine has ever seen: artificial intelligence. It's this massive technological shift that promises to make things more efficient, improve how we treat patients, and really just reshape the entire idea of healthcare. But, to really get what's going on, we have to look past the hype. So let's dive into how AI is already changing things for doctors and for us, and what big hurdles we still need to jump over to make it all work. Okay, let's just park on this idea for a second, because it's a big one. For years, the big, scary headline was AI is coming for doctors' jobs. But that conversation, it's totally changed. The real point of AI, it seems, isn't about getting rid of the human doctor, but about fixing a system that, let's be honest, a lot of people feel is broken, overworked, and just crying out for a fresh start. So, where do we even start to see AI's impact? Well, it's not with some sci-fi robot surgeon. Nope. It starts with a problem every single doctor deals with right now: paperwork. And burnout. The administrative load is just crushing. And that's actually one of the very first things AI is helping to solve. You've probably felt this, right? You're in the exam room and your doctor is staring at a computer screen, typing away instead of looking at you. It's a huge complaint, but AI is starting to flip that script with something called ambient listening technology. Just imagine a tool that's quietly working in the background, capturing the whole conversation. This lets the doctor finally put the keyboard down and put their focus back where it should be, on the patient. So these AI scribes, they handle all that tedious note-taking that eats up so much of a doctor's day. They can spit out high-quality, organized clinical notes almost instantly. This frees doctors from what they grimly call pajama time. Those extra hours they spend at home late at night just catching up on paperwork. And look, this isn't just a nice idea. We've got the numbers to back it up. A pilot study found that these AI scribes save doctors, on average, 3 hours a week. 3 hours. That's a massive win in the battle against burnout. It's time to get back for patient care, or maybe just to breathe. Okay, so AI is already a huge help with the admin stuff, but what happens when it moves from being a scribe to, well, a co-pilot? This is where it gets really interesting, where AI starts to partner with doctors in making diagnoses and discovering new treatments. Think about drug discovery. Finding a new medicine is kind of like searching for one specific key in a pile of billions. It can take over a decade and cost a fortune. AI is a total game changer here. It can sift through these gigantic biological and chemical data sets to predict if a drug is likely to work long before it ever gets to a lab. It just shortens the timeline like you wouldn't believe. And get this isn't some far-off dream. It's happening right now. Companies coming out of places like DeepMind are actually seeing their AI-designed drugs go into human trials. That's a huge milestone. It marks a fundamental shift from the slow trial and error way of doing things to a much smarter, predictive model for making medicine. Now this is where things get really fascinating. A recent study took a look at diagnostic accuracy on really tough cases. Doctors on their own, they got it right about 3/4 of the time. The large language model by itself, a staggering 90% of the time. But here's the real kicker. When the doctor used the AI as a co-pilot, their own accuracy went up. See, this isn't about human versus machine. It's about human plus machine. It's about making us better. All right, so the potential is huge, right? But with that much power, you absolutely have to ask the hard questions. Before we go all in on these tools, we have to talk about the risks, because the stakes just couldn't be higher. And that's the pivot. We've seen all this incredible promise, but to do this safely, to do it ethically, we have to understand the dangers. In healthcare, you can't just move fast and break things. We're talking about people's lives. So the experts have basically flagged these 5 big red flags. You've got questions like, who's on the hook when an AI gets it wrong? That's a big one. But honestly, the most fundamental problem, the one everything else is built on, is the data itself. If the data we use to train these AIs is biased or incomplete, then everything that comes out of it is going to be flawed. And this quote from Dr. Leo Salih really just hits the nail on the head. Trying to implement AI basically forces us to see all the cracks in our current system. It's like a Trojan horse that reveals all the weaknesses. So the goal isn't just to build a cool algorithm, it's to build a whole new system that's designed for humans from the ground up. And let's be crystal clear, this isn't just theory. This is real-world harm happening to real people. When your data isn't representative, you get things like a skin cancer detector that doesn't work well on darker skin. or a sepsis predictor that's wrong half the time. It proves that an algorithm is only as good as the data you feed it. Getting the data right, making sure it represents everyone, that's not optional. It's absolutely non-negotiable. So, after all that, the incredible hope and the very real hurdles, where do we land? Well, the consensus is pretty clear. The future isn't about replacing the doctor. It's about creating a powerful partnership. Augmentation, not replacement. It all comes down to this idea of a human in the loop. Think of it as the ultimate safety net. You take AI's amazing ability to find patterns in data, and you combine it with a doctor's judgment, their empathy, and their ability to understand a patient's unique story. The AI provides the data, the human provides the wisdom. And this future, it's arriving faster than we think. A recent survey showed that 2/3 of doctors are already using AI at work. But here's the kicker. More than a quarter of them don't even realize they're using it, which just goes to show how badly we need more education so doctors actually understand the tools they're working with. And that's why this education piece is so critical, because the most important skill for the next generation of doctors won't be memorizing every page of a textbook. An AI can do that in a nanosecond. It's going to be about learning how to ask their AI co-pilot the right questions to challenge the answers, and then weave that information into a truly compassionate plan for their patient. So at the end of the day, the question isn't if AI is going to transform healthcare. That train has already left the station. The real work, the hard work, is in figuring out how we built these systems to be safe, ethical, and fair for everyone. AI brings the data, we bring the humanity. The real challenge is, who do we trust to get that balance right?